So I've been having a lot of buddies in the surfing community here in Hawaii and in California going down to Mexico, Tijuana, to get their stem cell injections. And as a stem cell specialist, I was hoping you could shed some light on maybe why that's good, why that's bad. What are your opinions?
So the thing about going to other countries is that the doctors there don't have to follow all the regulations and guidelines from the FDA, right? We have a lot of regulations here in the US.
Sure.
And everyone complains about them, right? But the thing of it is, those guidelines are there to keep us safe. So yeah, there's a lot of restrictions we have in the US, but when you're thinking about getting something put into your body, like platelets or stem cells, or you just have to ask.
Well, I've been hearing it from my buddies. Well, hey man, there's no regulations, so that's awesome. They could put more cells in me and no regulations. But my alarm bells start going off in my head because whose cells are you getting? Where are they from? Are they human?
So that's the issue. Like, what do you trust, right?
Yeah.
So in the U.S., the FDA has made it very clear: any stem cells have to come from your own body. Platelets have to come from your own body. And currently in the U.S., there are no authorized products for knee arthritis, for our orthopedic conditions, that come from a stem cell in a jar kind of thing.
Yeah.
So that's something to watch out for.
Was that what you've been hearing is going down in like Tijuana or Medellin, Colombia? Like they sell you stuff in a jar?
I don't know. That's the thing. I don't know where they get them from. And so the thing to think about though is that I have seen advertisements about IV stem cells. So IV stands for intravenous,
right,
which means cells are going to go through your vein. Just like you get IV fluids in the emergency room, but instead they'll put stem cells through there. And the thing of it is, the size of the stem cell, if you look at it under an electron microscope, it is about 10 to 20 microns. It's a very small thing, but 10 to 15. But the size of the blood vessels that they have to go through is actually closer to 5 to 10. It's like half that size. So what studies have shown is if you try to put stem cells through your IV, they're going to get caught up in your lungs, and that's a big problem.
So I wanted to make sure I was accurate when I read this article. It said if you're getting mesenchymal stem cells,
those are the ones we want to use for
from your
orthopedics,
fat,
that sort of thing.
from your fat tissue, right? But if you get those delivered through an IV, I think it's like 97% get located in your lungs and maybe 3% to your joints.
Yeah. So what happens is, you go back to just basic high school biology, right? And the blood goes from your heart, it gets pumped to your lungs, right, where it picks up oxygen, and then it comes back to your heart and gets pushed out to your arteries, the good blood. And after your body takes away all the oxygen, the tired blood comes back through your veins, and from the veins it goes back to the heart. From the heart it has to go to the lungs again to get more oxygen. And it's that part in the lungs where the blood vessels are so tiny.
It's stuck.
Right?
It's stuck.
They get stuck.
For lack of a better word, right?
And that can cause an embolism. It's called a pulmonary embolism.
Sure. Yeah.
And that can be quite deadly. So I don't know exactly what happens, but that's the thing. I mean, you have to feel comfortable trusting the doctors that are doing these procedures for you.
And that's pretty scary.
Yeah.
So yeah, to put it bluntly, if you go down to, say, Mexico or another country, and they're only offering IV treatment for stem cells, that's my concern.
Yeah.
Is it safe? Maybe. Is it effective? Maybe. Because from what I understand, these IV cells are not going into the joints where they're promising you that, it'll get to your knees, your hips, your back, it'll heal your whole body. But from what I know about physiology, that's just not going to happen.
Yeah, the stem cells are not going to make it there. And the other thing is, if you are going to get an injection and your doctor is saying they're umbilical or placental or amniotic, those cells, if they've not been frozen and processed properly, are not going to be alive. So
that's a whole other thing.
That's a whole other topic, right?
Right. Because it has to be stored.
You have to store them.
Negative 200 Celsius? Is that appropriate?
Mm-hmm. Well, I'm not sure the exact temperature, but
in any case,
to restore them, a lot of those products, I've seen the marketing materials. A lot of these products say you just have to roll the bottle around in your hands to heat it up, and that's
or like add bacteriostatic water or whatever, shake it up.
So the reality is, it's not just add water and inject. I mean, there's much more careful protocols, and there are clinics that store cells,
Sure.
but there are very thorough, meticulous ways that those cells have to be restored. So, one of my buddies, when he was in college, he, gosh, we're going back to the 80s now.
Don't date yourself too much. No, okay.
He told me he was going down with his buddies, his fraternity buddies, and they were going to go to Tijuana. And when they came back, he said, hey, we had a great time. And he told me, yeah, we got a sunroof put into our van.
Interesting.
And I said, wow, how much is that? He said, hey, it only cost me like $100 or something. It was, I don't know, it was cheap. And I said, really? He said, yeah, well, we were drinking and we parked in front of this bar, and this guy said, hey, you want a sunroof in your van? And he said, I can do this for you in a few hours. So we went in, we had in the bar, had dinner, messing around, and came out. The guy was in the process of taking a saw and sawing through the roof and installing a roof with a snap-on vinyl cover and 2x4s to reinforce the edges.
Technically, he didn't lie. He paid for a sunroof.
It's a sunroof. So the question becomes, look, how are you going to get this done? It's going in your body. And, I know some people who go abroad to get medical procedures done. They go to Israel, or they might go to, there's a really good hospital in Thailand.
Bumrungrad.
I'm not sure how to pronounce that.
Yeah, but I've had my friends go there for medical procedures. Bangkok, they're well known.
I think that it really comes down to, finding out who's the doctor who's doing these procedures, what's their credentials. It's just like anything else. It's when you're in the States, right? You ask questions.
So I had one patient, just while we're on the topic, he went to BioAccelerator in Colombia, Medellin. And I said, all right, what do they promise you? So he did the IV treatment. I think the base was $20K. And then he paid around $10K for intra-articular. So he did 2 shoulders, 2 knees.
Wow.
So I think his total was like $60K.
Wow.
So then I said, okay, same question. Where did the stem cells come from? Were they from your tissue? Were they from a jar? He goes, I don't know. They just injected me.
Yeah. So, okay, here's the thing.
So much to unpack.
And some people, first the thing to remember is that we're not going to know if there's any bad outcomes or not. But in the U.S., at least there's oversight, right? There's hospitals and ways that we keep track of these things.
Sure.
Complications, that is, right? But the other thing you have to ask is, if you're going to get these done and there is a complication, who's going to be helping you with that once you go back home?
Or if you're still in Mexico.
Yeah. Or, well, not just Mexico. Could be anywhere.
Yeah, right.
Could
Korea,
be anywhere, right?
Anywhere they're offering stem cell therapies, sure, around the world.
Okay, so we've talked about those kind of situations, but I'm sure there are people probably listening or watching who might say, hey, I know someone who had some good results.
Sure.
And then you're saying, well, what did they get? So to be sure, I'm sure those cells, if they got IV, they probably got a lot of them hung up in the lungs. But in those cell preparations, there are probably growth factors. Now, growth factors are signaling proteins, cytokines. Our bodies, our cells, and the cells in our bodies release those to signal that healing process. That's how the cells in our bodies communicate.
So there is some stuff going on, even
there could still be stuff getting injected. That is having some type of effect. But if you're being told that you're getting live stem cells via IV, you got to do your homework to find out exactly what the docs are injecting.
And in your eyes, the safest, most effective way to get stem cells would be?
Is your own cells.
Okay.
So either your doctor's using your own platelets from your own blood, or they're using a fluid from your bone marrow. That's one way doctors can get mesenchymal stem cells. Some ways include getting it from adipose tissue. But the point there is
not as effective as your bone marrow, though, right?
Well, the overarching message is the cells. The safest way is for them to come from your own body.
Yeah, less risk of tumors and genetic abnormalities like with umbilical, right?
And there is something called graft versus host disease. So when you hear about people getting kidney transplant or liver transplant or cardiac transplant, that there's a lot of testing that has to be done to make sure that the transplanted tissue does not create an immune response.
Yeah, autoimmune attack, right? Yeah.
And the cells, if they are coming from someone else, and there's a lot of misinformation about whether or not these types of cells cause an immune response. But again, you have to ask, where is this coming from? Like, where are the cells coming from?
Right. Well, I'm so happy to ask you these questions because as a Harvard-trained stem cell physician, it's good to have you right here next to me because like everyone else out there, we're inundated with Instagram and YouTube videos of, stem cells in Mexico.
Well, there's all kinds of information,
Yeah, and
Dr. Brian. So
sure, yeah, you don't even know what to believe. That's my point. Yeah. So thanks for sharing.
All right. Well, thanks for tuning in,
Yeah.
and we'll see you next time.
Yeah. Aloha. Till next time.